how is this going, this preparation, I suppose, for 1B?
It's a very interesting time, and as you said, it is very busy and there's an awful lot of inquiries coming through, as we had all expected.
So you'd all expected that. Was there enough expectation or preparation from the government? Is it going well, or is this period not going as well as you'd hoped?
It's going very much as expected, and so far it's getting the teething problems that one would expect, but certainly no greater than anticipated. If you imagine a system whereby there are 80 or 90,000 clinicians in Australia, many of whom are practicing every day, seeing patients like me, and are booked out every day and are busy, and somebody comes along and says, I'd like to make an appointment for 40 million people, there are obviously going to be teething issues, but they are being managed, as far as we can see, pretty well and with very good communication and consultation. What happens when a gigantic Australian project like this gets undertaken that has hardly ever been taken before is that there's going to be a lot of demand in the early stages, and I suspect that we're going to look back on this in about 3 or 4 weeks' time and think, well, things are running pretty smoothly now. We know that the hard-working GPs of Australia are very, very well prepared.
Right. So talk us through that preparation, because there are reports that, some waiting lists are already exhausted and uncertainty of supply. What's your experience so far? Can you give us some specifics of how your system's working, how many people are contacting you, your vaccines and so on?
Well, there are 2 groups of practices in general. There are those who have put in their expression of interest to give the vaccine, and those that have not, for whatever logistical purpose. And that's actually quite good too, because there's going to be a lot of patients who can't see their GP because their GP is going to be giving the vaccines. And so the practices that aren't are going to be taking up that slack. The practices that put in their expression of interest to give the vaccine were initially very worried because they thought that they would have to have a minimum 1,000 doses per week, because that's how much is in a box. That's been changed pretty well, so that now practices are going to be getting units of about 50 vaccines per week. Some practices will get 100 or 150 or 200 and so on. And so what we've gone from a situation where practices were a bit concerned that they'd have to close their business for business as usual and only give the vaccine, to a situation where some practices might like to have more vaccines than they have. They've got to work out their booking system. They've got to work out which patients they contact, because patients have been ringing a centralised Department of Health number, and understandably in the first few days that number's open, it's going to get flooded with a lot of calls, and then those calls go automatically to the person's own GP. All of this is something that the government is working together with all of the big agencies, and I understand the Prime Minister's giving a press conference at 1 o'clock today, having discussed that with the AMA and the College of GPs and the College of Rural Medicine.
All right, well, that's interesting. We'll look out for that. In terms of that supply, I mean, this seems to be a crucial issue, whether you have too many or not enough vaccines. How is that going to be managed? You might have 1 week where you say, I've got 30 more than I thought I'd need, and the next week you're getting call after call and you need another 200. Is the system responsive enough for that?
I think the system, by definition, it's very hard to get a gigantic government system that's going to work responsively to that. But what we do have is a network of 6,000 general practices in this country, and they are incredibly decent and collaborative people. And I think that we will work this out as we go along with ourselves. To give you an example, in Canberra, there's about 75 out of 90 practices have put in their EOI. About 18 of those practices will get some vaccines starting on Monday morning, we hope, and that will build over the next few weeks. And over the next few weeks, they'll each get more, and then we'll pick up more teething problems as we go along. We don't even know what some of those problems are yet, and then we'll get better and better at handling it. I think people can be pretty assured that it's going to work out.
Well, just finally, will you be calling people on your books already if they are eligible and haven't taken up the vaccine or put in a booking, and trying to say, would you like to come in, suggesting it's a good idea to try to drive up vaccination rates?
We may well do that. Most practices, including our own, have started to make lists of the patients who are in 1B and are eligible for the vaccine. However, it's so so complex, particularly in practices that are incredibly busy already, that as you can well imagine, by the time we contact some of those patients, they will have had their vaccine already, some of them, or they will have decided not to. But certainly, I can't, to answer your question specifically about that issue, most practices that I know have already started making their lists of people to call.
All right. We appreciate your time today. Well, not too busy just yet, but you will be soon. Appreciate your time and talk again soon.
Thank you.